Greetings, everybody. Thank you for joining us for our Systems for Action research webinar today. My name is Glenn Mays. I direct the Robert Wood Johnson Foundation Systems for Action National Program Office based here at the University of Colorado. And you're joining us for part of a regularly scheduled research in progress webinar series that we conduct every couple of weeks. You get a chance to join us in this webinar and you hear about research that's being conducted by collaborators in the Systems for Action research program. For those of you who might be new to the S4A program, let me tell you a little bit about the kind of research that we conduct. The studies that are led in our program focus on ways of aligning medical care, public health, and social service systems, helping the delivery and financing systems that operate in medical care, public health, and social services, helping them work better together. And we focus specifically on testing novel system alignment mechanisms. And you're going to hear that term and that word in the webinar today. What do we mean by a system alignment mechanism? Well, it's some kind of resource or initiative that helps stakeholders working in medical care, public health, and social service delivery, helping those stakeholders work better together. It could be ways of sharing information and data across sectors. It could be novel governance or decision-making structures that facilitate collaborative decision-making across medical care, public health, and social services. It could be novel financing mechanisms that help stakeholders share resources across those sectors. Or other forms of collaboration and coordination that can help fundamentally help organizations and stakeholders work productively across sectors. So that's really the focus of all the work, all the research that we conduct in Systems for Action, and that's what a system alignment mechanism is that you'll be hearing more about today. Okay, so let's talk about what we're going to be hearing from today. Today we're going to be hearing from several different research projects that are all that are supported through the Systems for Action program, that all focus in some way or another on the housing sector and helping housing systems and resources work better connect with their public health and medical care systems and stakeholders. And so with that, as you can see, today we'll be joined, our moderator today is Dr. Ricardo Baserto de Villa. He is with the Los Angeles County Office of the Chief Information Officer. Ricardo has also been a past grantee of the S4A program and currently serves as a member of our National Advisory Committee for Systems for Action. And then you can see the other panelists who are joining with us today are all involved in Systems for Action research projects that have relevance for the housing sector, including Dr. Irene Vidyani, who's also with LA County, but we'll also hear from Dr. Hee-Sung Yang, who is at the University of North Texas, as well as Dr. Jesus Valero, who's at the University of Utah. And we are doing something a little bit different in this webinar from some of our previous webinars, in which we've actually designed a panel discussion to hear from multiple investigators from multiple S4A studies. So with that, I will turn it over, I believe, to Irene. Are you going to kick us off?
Yes, thank you, Glenn.
Mm-hmm.
We are starting off today with just a brief description of the two research studies that we are discussing today. So I'll start off with mine. So the Systems for Action study that we're doing out of LA County is assessing an initiative called Mama's Neighborhood, which is an initiative to close gaps in health and social services for low-income pregnant women in LA County. So this initiative uses a coordinated approach to assess and address client needs in 3 core pillars of health: physical, mental, and social. So this is very much in alignment with the Systems for Action philosophy of aligning systems across the public health, medical care, and social services sector. And this addressing client needs across these 3 core pillars of health is really necessary, because we need to address the underlying social determinants of health to address the poor birth outcomes in LA County among this low-income pregnant women population that are served by the safety net hospitals in LA County. So this initiative uses a medical home and home visitation model to address this underlying issues among pregnant women in LA County across multiple sectors, be it social services, housing, domestic violence, mental health, and so on. And even though housing is not the primary focus of the initiative, we are hoping that I can provide some perspective of providing housing and addressing housing instability among this population from the maternal and child health perspective for this panel. The research questions that we have for the study are the 3 that you see on the screen here. What are the outcomes of the initiative? Have the programs reduced inequities in outcomes across various risk groups and various race, ethnicity, and other subgroups? And how effective are the cross-sector linkages that have been formed by the initiative? We're using mixed methods for our study, and we are using a combination of quantitative analysis of linked administrative data, linking data from the multiple sectors, as well as the Mama's Neighborhood data. We are also using qualitative analysis of interviews of Mama's clients, patients, as well as Mama's providers. And we are also conducting a network survey of community-based organizations that are part of Mama's Neighborhood that serve Mama's clients across these various sectors that you see on the screen. So what you see on the right-hand side of the screen is some preliminary results of the cross-sector impact of the Mama's program. As you can see, we are looking at the impact across various sectors, social services, including receipt of benefits, including income assistance and food assistance, housing, justice, mental health, and health. And we're still in the midst of analysis right now. And we have some preliminary results on what the rates of receipt of benefit or rates of arrest or mental health crisis are 1 year before enrollment in the Mama's Neighborhood initiative versus 1 year post-enrollment in the initiative. And as you can see on the screen, it does seem that the preliminary results suggest pretty encouraging outcomes with increased rates of receipt of income assistance and food assistance, reduced rates of arrest, reduced rates of mental health crisis, and reduced rates of ER visits. And this is just one aspect of the mixed methods methodology that we are using. There's still plenty more, and in the panel, I will be speaking on some other preliminary results that we've seen in the study. So at this point, I think I'm handing this to Hisan and Jesus to give a brief description of their study.
Absolutely. Thank you so much, Irene, for passing it on to us. So I'll be introducing the study or studies that myself and Dr. Zhang have been engaged in over the past couple of years. For now several years, she and I have been incredibly interested in studying what are known to be continuum of care homeless networks. These are community networks that are mandated and encouraged by the U.S. Department of Housing and Urban Development to be the preferred method by which to pool community resources to address the challenges facing individuals who experience homelessness. And so across the country, there are well over 300 of these COC COCs that we call Continuum of Care Homeless Networks that are active in working across the community, across the service sectors, the public health, medical and social services, in order to tackle the challenges that the community is facing uniquely around the issue of homelessness. And so since 2017, we received our first sort of funding support from the Robert Wood Johnson Foundation Systems for Action program. And so we're incredibly grateful for the opportunity to have received resources to study, this important phenomenon across our country. And so in our first study, we were interested in knowing more about the degree to which COCs as a system alignment strategy that is working to bridge the various service sectors in improving health and health equity among individuals who are experiencing homelessness. And so through that study, we engaged deeply in conducting several case studies and launching a national survey to understand the degree to which these COCs are working towards addressing the broad healthcare needs of individuals who experience homelessness. And what we found is that there's a huge variety in terms of the approach to healthcare and the degree to which healthcare services are integrated into the work of the COC homeless networks. Specifically, our work found that those COCs that are better resourced, that are in areas that have greater capacity, the more likely that these networks were going to be able to work towards improving health and health equity among individuals who are experiencing homelessness. And so to build off of this work, our current study looks more specifically at examining the effectiveness of these networks in coordinating services during COVID-19. So this study began or is beginning in 2020 and is going to run into 2022. And so through this work, we want to know more about the degree to which COVID-19 is challenging these communities and in what ways, and the factors that are explaining, the success of these networks in responding to the demands that are exacerbated by the COVID-19 pandemic on individuals who are experiencing homelessness. And so this work is going to begin this year with a series of case studies of COC networks. And our goal here is to work towards including important interviews with individuals who are at the leadership of the COC, housing, as well as medical leadership. And so we are, super excited to begin this work over the summer months. And so we have worked towards identifying COC networks that through our previous research were high performing in the area of healthcare, as well as those that during the pandemic were found within COVID-19 hotspots. And so in addition to that, we are open to including other COC networks that are willing to be a part of this study as a way to expand the sample of entities that we're working with. And so I know that we work towards inviting as many COC leaders and policymakers into this webinar. And so if your particular community is interested in forming part of this research over the summer and into next year, we'd love to hear from you. And so please feel free to reach out to us, with through the Systems for Action website, as well as the information that's included in this webinar. And then building off of these case studies on year 2, which begins in 2021 and 2022, I'm sorry, we plan to learn from these case studies and build on what we've learned there and to infuse that into a structured, systematic national survey of the 3 key service communities, the COC, medical services, and housing organizations. And here our primary task is to really understand the conditions, the environment, the factors that explain the success of these community networks in responding to the challenges facing individuals who are experiencing homelessness. So we're thrilled again to receive this funding support through the Systems for Action program and look forward to connecting with all of you post this webinar in ways that we can work together to better understand how the pandemic is affecting these important community networks that are responding to the needs of a very vulnerable population in our community. So look forward to engaging more further through the Q&A as well as through our panel discussion.
Okay, I think it's time for me to start leading the next part of the panel discussion. First of all, I want to thank again the Systems for Action program for the invitation to serve as the moderator for this initial series of panel discussions. And second, like Glenn mentioned, if you don't mind, before we move to the next section, like Glenn mentioned, I'm a member of the National Advisory Committee for the program. And for a couple of years, we've been discussing, the great research that has been funded to the program. There's some really important questions that are being answered. And because the nature of the program is cross-sectoral, then obviously there's plenty of overlap between different projects that are looking at maybe similar questions, or at least related questions that are focusing on similar sectors with health, public health, social services. So we've been wondering, how can we find a way to kind of combine the findings from projects that are related and see what we can get, rather than looking at individual trees, looking at the forest and what the projects that tell us about these mechanisms, how they work, how they improve outcomes, etc. So this is our first attempt to do that, to talk about two projects that are separate, but that obviously have quite a bit of overlap in the questions that they're asking and the mechanisms and the areas that they're studying. And I'm very excited that we're finally doing this, and that we have this great panelists, and we have such a great turnout also in the audience. So again, I'm just thankful that we're doing this. And okay, let's move on now to the questions for the panelists. So first of all, and let's start with Hisan and Jesus, the homeless policy study. If you can help us answer, what cross-sector alignment mechanisms have you seen through your study that have continued or strengthened during the pandemic?
Yeah, absolutely. So we have focused on like the communities, how they are serving the homeless population, and see how the cross-sector alignment, the continuum of care, does its job before and during the pandemic. So continuum of care is legally codified cross-sector and cross-service industry alignment mechanism that is community-based and locally developed network of diverse, like the service providers and stakeholders, including government agencies, social service nonprofits, school districts, and medical service providers, and hospitals, and so on. So from our previous research, that we found COC is an effective cross-sector alignment mechanism that reduces duplications and fragmentation of services and improve coordination, effective coordination among cross-sector and distinctive service industries. So many COCs are making very positive impact because they develop local approaches that fits to the demand of their service population and like understand their service capacities. So, and each of the COCs are unique and different. So from our previous previous research, we found more than half of COCs are led by nonprofit organizations, and about a quarter of COCs are led by either counties and cities. And so one of the notable changes we observed during the pandemic in the COC governance was important role of local government entities like the counties and cities. And we suspect in the time of pandemic, these federal resources came to the cities and counties directly. And the counties and cities have their own discretion and the choices, the way they utilize these resources in service of homeless population and their efforts to prevent further homeless, like the evictions and create more of the homelessness. So we have observed many of COCs are doing amazing work to engage, adapt to these daily pandemic challenges and disruptions in service of most vulnerable populations. And they had to create extra shelter services, and they had to create quarantine locations and care facilities. Many tremendous efforts has been made. And one of the major approach of the choice of many community was placing these homeless families and the individuals in individualized and stable housing settings. So many communities expedite and focus more on housing first intervention programs. So it has been quite a trying time, but at the same time, testing time of housing first principle that is providing permanent housing with supportive services without mandatory prerequisite conditions. So we have seen many success stories from communities like Houston, Texas, DC, Washington, DC, San Diego, Philadelphia, and each of these communities have its own unique approaches of to implement these housing first programs. And from these, there's like the observation, we found some very important commonalities among many of these communities, which is strong nonprofit leadership in development of holistic service mechanisms. So social service nonprofit could bring in values to the system and create more individualized service approaches to each of the cases. And the slogan of it's housing first, not housing only, once again emphasized. So collaboration and cross-sector approaches was integral for the success of housing first programs. That would be our response. If
Thank you,
Hezes have anything to add.
Okay. Irene, how about you? What have you seen through MAMAS or maybe other experiences?
Thanks, Ricardo and Hisan. So the MAMAS Neighborhood Initiative, as the name implies, this cross-sector alignment mechanism is actually baked into the initiative, that neighborhood component. So in MAMAS neighborhood, there is a neighborhood, the community of community-based organizations and other providers across various sectors that work together to serve the various needs of the MAMAS clients, whatever they may be. In the beginning of this webinar, Glenn mentioned that the purpose of Systems for Action research program is to test various cross-sector alignment mechanisms. So with regards to the pandemic, I'd like to mention one cross-sector alignment mechanism in particular, which I think has come into full force, which is shared purpose. So in the cross-system alignment theory of change, to sustain impact, a core component of cross-sector alignment is shared purpose among cross-sector collaboratives. So this shared purpose previously was already present in the MAMAS Neighborhood Initiative, because obviously all of the community-based organizations, MAMAS providers, they all share this purpose to better the lives of their clients, which in this case is low-income pregnant women, be it in housing, substance use, and improving birth outcomes and whatnot. But the pandemic really is a driver of cross-sector alignment, because it provides really more of that shared purpose as collaboratives try to address expanded client needs across multiple sectors. And they're really facing the same kind of issue, and now this issue becomes kind of urgent, and all of them are seeing this expanded client needs across multiple sectors. Some of our preliminary results also hint that that might be the case, but we also see that shared purpose alone may not be enough in the pandemic. It needs to be backed with funding, consistent and coordinated communication with partners, and strong relationships. So one part of our study is to conduct a network survey of the community-based organizations across multiple sectors that are part of MAMAS Neighborhood and that provide services to MAMAS clients. This wasn't part of our proposal, but when the pandemic hit, we added a few questions to the network survey to assess network resiliency during the pandemic. We have not closed the survey yet, but preliminary findings from submitted responses around the responses of these organizations during the COVID pandemic have been encouraging. Interestingly, a majority of respondents reported that COVID has had no impact on efforts to foster cross-sector collaboration, and 16% even said that partnerships were strengthened by COVID. And we also asked whether organizations were able to expand services to respond to COVID-19 and to respond to the expanded client needs. And 40% of organizations were actually able to expand services, either a fair amount or a great deal. I must caution that there might be a bit of selection bias going on here, because we haven't closed the survey yet, and the organizations who have responded thus far may be the ones that are less impacted by COVID and the ones who are perhaps more resilient to the pandemic and therefore are able to respond to our survey. And that might be why we are seeing the results that we are seeing. But still, I see it as an opportunity for us to learn from organizations and collaboratives that happen to have resiliency in this pandemic era. So we also asked about factors that have had the greatest impact on the organization's ability to continue and provide and sustain services for clients during the response to COVID-19. And we heard client needs as being one of the common factors. So again, that's the shared purpose that I mentioned in the beginning of my response about how the pandemic provides this shared purpose to address expanded client needs across these various sectors. And then the second most common factor that is cited is funding. And then consistent communication with partners, location of client population, referral coordination, and strong relationships with other organizations. So beyond that shared purpose, there needs to be internal and external factors such as funding, consistent and coordinated communication with partners, and possibly having that capital of strong relationships that have been built before the pandemic that can help them sustain this shock to the system that they're seeing in this pandemic. And I think that's sort of echoing also what Hisan mentioned about the need of that capital in various aspects. I think she mentioned also strong leadership and the workforce that has that capability to withstand a shock like this. In our case, that sort of social capital is actually what kind of gets lifted up, that relationship with other organizations, that consistent and coordinated communication with partners. So we are also planning to conduct more in-depth interviews with this community-based providers. So we will have the opportunity to learn more in interviews to understand more about the responses that that in the network survey we hear about how people are responding to the COVID pandemic. Back to you, Ricardo.
Okay, thank you, both of you. There's a lot of information to unpack on both of your responses. Just a quick take from me. It seems, something I found both of you mentioned is kind of like a deliberate intent to address needs in multiple sectors. I mean, Hisan talked about housing first and permanent supportive housing, and how housing first is not housing only, but there's a prioritization of housing, but it also there's an intent to address other needs. And like Irene said, this cross-sector focus is baked into the MAMA's intervention, that the goal is to address multiple dimensions of needs. And so that seems to be one important factor in determining success in what we've seen in the last year, besides the many other things. Obviously funding, both of you talked about funding and coordination. Those things are also obviously very, very important. So okay, if we can go to the next question. And this time we're going to start with Irene. So Irene, what are the policy levers relevant to achieving more equitable outcomes in housing you have seen?
So I would say there are 3 areas where it's very important to have the policy levers to achieve more equitable outcomes in housing. So the first one is getting housing to people at the right place at the right time, wherever and whenever that may be. And then the second one is accurate matching between needs and provision of services, including housing and other supportive services. And finally, the third one is navigation of the system, not just for clients, but also for providers. So I'll talk more about each one of those. So the first one that I mentioned is getting housing to people at the right place at the right time. This is something that is a recurring theme that we hear when it comes to housing through our patient interviews. We heard from people that that is really important, to not really be restricted to having to get housing at the specific locations, at specific housing providers. And in fact, that's kind of part of why the Mamas Initiative was born, because even though Mamas Initiative is run out of the Department of Health Services in LA County, and the main population served is low-income pregnant women, there is a really high degree of housing instability among this population. So before the initiative was set up, some preliminary assessments showed that 30% of this low-income pregnant women who are served by the Department of Health Services in LA County have housing instability. So when patients come in to DHS for their maternal, for their prenatal appointments, or when the home visitation teams visit the homes of patients, oftentimes there's an assessment of housing needs, and often this comes up. And for pregnant women, especially at that time in their life when they're already dealing with so much, this often becomes a pretty prominent issue. So just, yeah, again, I think getting housing at the right place at the right time, wherever that may be, whenever that may be, I think is very important. And this is, I think, even more important during the pandemic. We've also heard from some patients about how during this pandemic, some of them ended up being really motivated to get out of shelters because they're pregnant, and obviously there are multiplied expanded health risks with being pregnant in a pandemic in a shelter shared with other people. So they become more persistent about getting out of shelters and getting into permanent housing, and this is really the right time for them. This is the right place for them. So I think that speaks to the need for really strengthening cross-sector alignments and making sure that housing is an issue that every part of the collaborative is ready to address, whether within their organization or with quick, consistent, and coordinated referral to other partners in the collaborative, because I think that's an important part of being able to getting housing to people wherever and whenever they need it. Like, no matter which part of the collaborative they come into, if there is housing need, the collaborative needs to be nimble enough to address that. And then the second issue is accurate matching between needs and provision of services. Obviously, if we want to achieve more equitable outcomes in housing, we need to be able to provide the services to people who really need them, so that we can end up with equal footing with those who may have less severe needs. But this is actually pretty difficult in practice. I think everyone in the audience probably are familiar with this. There's obviously the gap between supply and demand in the housing supply, and as well as the supply of appropriate supportive services. And there's also a complication. This is further complicated by complex funding and eligibility criteria for various types of housing. So this concept of being able to match needs and provision of services oftentimes in practice just does not really happen. People will try to match as best as they can, but I think a lot of the times what happens is the providers will try to just place clients wherever there is housing available, just because the housing supply is so tight. Whatever is available based on the eligibility of the clients, not really, like properly matching between needs and provision of services. And, this is complicated by those various factors that I mentioned. So it's policy levers to help address those underlying factors as well as really to more accurately assess needs as well as match the needs of the clients to the services that they need. I think those are really important. And then finally, the third aspect that I would bring up is navigation of the system for patients, but also for providers. So this is another very, very common theme that we're hearing from patient interviews when it comes to housing, that it is just very difficult to navigate the system and get housing of some sort, throughout the entire spectrum of this process. And they are very grateful to providers who they have built trusted relationship with, because they realize oftentimes it requires persistence to be able to get housing. And again, to achieve equitable outcomes in housing, we really shouldn't rely on how persistent people are in getting housing, as well as just how smart they are in navigating the system. We really need better navigation for patients. But I think what's interesting is that from my other non-systems for action work, I have been communicating with providers in community-based providers providing housing, and they also said that it would be great if they have some sort of help in navigating the system, because that's just how complex it is, in terms of eligibility criteria that are very myriad and very different among the different housing programs and the different funding criteria, the different kinds of needs that people have, the availability of housing. It's really striking to me that I think one thing that many providers said to me in there is saying that this is something that is absolutely needed. So policy levers around navigation, I think, is sorely needed. Back to you, Ricardo.
Thank you, Erin. Jesus, Hisan, do either of you want to take on this question?
Absolutely. And so a couple of things that I'll talk about really briefly are things about governance that's collaborative, attention to policies and resources that are, really addressing affordable housing, strategic plans, and data integration. These are all sort of key policy levers that are critical towards achieving, any kind of successful outcomes in sort of like the collaborative COC world. So first, at the governance, sort of question or issue here, it's really important that governance at the state and local level is collaborative. The decision-making processes must involve, all affected and interested parties, including those with lived experience and subject matter experts. The research around collaboration and networks is very clear that in order to be successful in achieving any kind of success in your work together, all interested parties, need to be a part, and effective stakeholders need to be a part of the collaborative process and have a seat at the table. This allows for the development of policies and practices that are trauma-informed, responsive to needs, and equitable for those who are actually experiencing homelessness in the local community. Number two, I think a real attention to policies and resources that develop deep affordable housing of all types. Across our research, when we ask about gaps in the homeless service system, whether at the local or national level, what we hear constantly is, there is just simply a need for more housing. We can't, help individuals step out of homelessness, out of the shelter system, unless there is affordable housing for us to place them in. And this is sort of, of affordable housing of all types, more shelter space, more permanent supportive housing, transitional housing, as well as specialized beds for those who may be experiencing mental health crises or need a detox sort of support system. And so this also involves engaging in innovation and thinking outside the box in order to help the community and think about strategies that can be tested and can be effective. This also involves understanding the perspective of those with lived experience or currently experiencing homelessness to understand their needs and how to navigate the system. There is a gap in understanding their perspective and developing strategies and programs that actually work. And then number three, strategic plans are critical towards really coming up with joint ideas, solutions, and also benchmarks for the progress that we want to see in this area of increasing the availability of housing and helping individuals step out of homelessness. And so developing strategic plans at the local and state level that engage all key voices in identifying gaps, solutions, and plans are critical. Not every community is the same. For example, rural communities face unique challenges, mostly related to the lack of resources that large cities have. So plans for rural communities should reflect the realities, while at the same time putting strategies in place to build connections and networks to more resources, more resourced communities for mutual learning and exchange. About 2 years ago, the state of Utah, for example, underwent a very deep thinking process to develop a strategic plan that responded to the statewide needs around homelessness. And so if you're interested in seeing an example of a statewide strategic plan, you can simply do a Google search for State of Utah Homeless Strategic Plan. And so that could give you some good ideas of possible ways of thinking about how to develop this plan and what might be a good way to pursue this and what to include in some of these works. And then lastly, data integration is also an important conversation and policy lever towards achieving more equitable outcomes in the housing world. Data integration is key to understanding the magnitude of the problem, including the specific needs in the area of housing for individuals who experience homelessness. There really is a need for understanding the degree to which the various sectors and service agencies are integrated and plugged into the work, and it can be advanced. That area of work can be advanced by the sharing of data from organizations in the medical, social service, and in public health. So again, some policy levers, that can help in achieving equitable outcomes include collaborative governance, attention to policies that develop deep affordable housing, thinking about engaging in the strategic planning process and data integration as well. So these would be some of the points that I would suggest to be critical towards achieving those equitable outcomes.
Thank you, Jesus. And I'm glad to see that there was quite a bit of overlap between the two answers. I mean, we see a lot of common points in terms of matching resources to the needs of individuals, coordination, collaboration. And then the last point you mentioned was the data sharing. It's something that here we in LA County we've been trying to emphasize for several years. It's obviously critical, and it's also part of that enabling coordination, collaboration, and to help everybody understand what resources are available and how they can be matched to the needs, and also help everybody understand the needs that in different populations, different communities. Also, that data sharing can be a critical piece of that. Okay, so Jesus Kison, if you don't mind to kick us off with the next question. So what recommendations would you give to someone interested in developing a similar intervention to what you've analyzed in your study?
Sure, thank you. So unfortunately, it is expected to see a COVID-19 related increase in homelessness in nation. So a wave of eviction homelessness will hit the society. and the public cost to bring back these families to the stable housing will be very expensive. And so that's why we have to understand and acknowledge the price of inaction that is far greater than the cost of homeless prevention. So this understanding about this price of the inaction has to be shared by key stakeholders, and we have to make it a kind of public awareness about this seriousness of these issues. So the prevention should be the key at this moment, and in this prevention related with the emergency rental assistance and the eviction moratorium and emergency housing vouchers. So let your community, and including your like the state and local governments, understand this huge public cost of inaction and why prevention is cost-effective and shortest way to recover from pandemic damage to society. And we have to build and nurture the collaborative network with diverse homeless service stakeholders. We have a kind of long culture and history of community services for the most vulnerable population, and bring these community actors and the stakeholders, including faith-based organizations and churches, on a communication kind of platform, and get them to offer their solutions to the problems. And we have to, at the same time, we have to use this unprecedented, like the federal relief funding in service of the homeless and prevention of homelessness, and use this right and make it more sustainable sources by developing these private resources to engage in service of the homeless population and prevention of the homelessness. So the short-term kind of intervention will be, yes, the prevention-based like approaches like the emergency rental assistance and the emergency housing vouchers that can be like a panel through this like the local and the state government. But at the same time, state government can make a very serious conversation about creating the funding sources that you will be covering these housing demand for not just a year, but this year, but like the quite like the long period of time, like the 5 to 10 years. And I want to say more about like kind of highlight and what Jesus just mentioned about the power like of the data sets. So we have to understand the data is the way that we communicate with the policymakers and funding decisions, and we have to see if there is a discrepancy between the point-in-time census data and like the HMIS, homeless management information system data, and the coordinated entries, and see where this kind of discrepancy coming from, and how this discrepancy or disparity is generated in a way to understand misunderstanding of racial representations of service demand of our communities. So building data that is more accurate and that is also shareable amongst the diverse stakeholders will be very important in a way to develop effective collaborative mechanism, cross-sector and cross-industry collaborative, like the alignment mechanism. And this can, and then these community can make a stronger case that bring this attention for the more policy actions and resources in a way to address the magnitude of the problem of the communities. Back to Ricardo.
Thank you, Ethan. Irene?
So I'll try to make this short. So first, I would advocate for trying to find a funding mechanism that allows for flexibility, and maybe this also goes out to funders out there to ensure flexibility and less prescriptive criteria for interventions, because that would be really important to enable the intervention to support the myriad needs of clients at various times. And I think that's also an important key in enabling that more accurate matching between needs and services in a situation where the housing supply is lacking, and where there's this complex navigation that has to be had. So other than that flexibility, we also need shared supportive infrastructure. And I think data has been mentioned, technology has been mentioned. But finally, we also very much need to make sure that such interventions are built with open communication, consistent, coordinated communication among the people in the collaborative and trusting relationship. Whether it's between providers and clients or among providers in collaborative. I think this is something that is a recurring theme that we've heard in the interviews and the network survey. And finally, I think the pandemic has also given us some idea about how to build the resiliency in an intervention like this, and having some buttressing support or redundancy in the system, I think is crucial in making sure that interventions can withstand other potential shocks to the system, whether it's a pandemic like this or changes in regulation and whatnot. And that's all I have.
Okay. Thank you, both of you. There was a lot of good advice and taking points, including something for funders. We hope some are listening, because I agree that flexibility is particularly important. So let's move on now to questions from our audience. We still have 10 minutes left, and let's see. You've heard us, mostly panelists, talk a lot about their takes on their interventions, what lessons have been learned, but we also want to hear from you on what you're interested in hearing more from them. So let's start. We have a question from Matt Levy. He asks if you have seen any success with the use of a community information exchange to help address the issues that we have been discussing in the panel. I don't know if any of the three of you wants to give a first shot at answering this question, if you're familiar with community information exchanges.
Yeah, I can try answering that question. So I think this came up when we were talking about policy levers that are relevant to achieving more equitable outcomes in housing, and when I was talking about the accurate matching between needs and provision of services, as well as the need for navigation. So you're right that community information exchange can be part of the solution to address those issues that I discussed. And in fact, in some workshops with some providers, I think that's something that that's a solution that was brought up. I think unfortunately, in practice, I think often community information exchanges, not the principle of it, but the implementation of it, I think typically falls short. So in LA County, we have well, I guess it's not really a true community information exchange, but we have a 211, which is a sort of a community information exchange. But from what I've heard from providers, it doesn't really help them navigate the system very well, because it's got many limitations in terms of what are listed in the system. It's got many limitations in terms of actually being able to provide the warm handoff to clients, and that they have mentioned it is something that is sorely needed by the clients. And then there's also CES, coordinated entry system for housing, that we have in LA County, but providers also said that it also still falls short. It doesn't have a list of all the housing available in LA County. It doesn't have a very good sort of matching mechanism between that needs and provision of services again. So providers end up having to do a lot of the underlying work of trying to do that matching themselves as best as they can, and then there's also little consideration for location, for instance. So they mentioned that a lot of times patients who are housing unstable, like they prefer to stay in a certain area because they have support from the community or family in that area. And CES, community information exchanges, often, really focus more on like where's housing available rather than kind of being able to, again, do that more accurate matching between needs and provision of services. That is not to say that the concept of community information exchange itself is, not a good solution for the issues that I've discussed. I think providers, I think, agree that it is. I think it's just the devil is in the details and the implementation, making sure, I guess, again, we talk about accurate matching between needs and services. In this case, I think community information exchanges, at least the ones in LA, are not accurately matching the needs of the providers when it comes to matching their clients to the housing that they need. And I'll throw it to Hisan and Jesus to see if they have other thoughts.
Yes, so information sharing is the key in effective response to the very diverse demand of homeless clients, and it is a part of like the HUD instructions to create the information system that really covers cross-sector, cross-industry systems to better serve the clients. But there has been quite a challenge to build more like the flowing information system here in the homeless service structures, and we've been seeing great examples, right? So this patient-centered like the care here in Harrison County in Texas, just build a great kind of information structure that is connecting criminal justice, cities and counties, shelters, and clinic and the hospital information with the value attached kind of case management to they better serve the the homeless clients.
Thank you, Hisan. Just my quick 2 cents. There's I think a fantastic implementation of a community information exchange in San Diego. From what I remember, it's been a while since we've talked to them, but they've done some analysis that have shown success in how they've done, and they have a very impressive platform, technology platform that they're using there. So I encourage anyone who's interested in seeing a good implementation of a CIE to learn more about San Diego. They have their own website, and there's plenty of information there. And I also have contacts, that I can pass to anybody who's interested in reaching out to them. I should also say, like Irene said, in LA we have not, done the best of implementations of the idea, but we're working on building better community information exchange, better technology platform that will allow for more data sharing between providers and information on clients. Maybe in a few years, somebody can design a systems for action study around our experience with this. We'll see.
If I may just add one quick thing on that, I think I just want to also mention the importance of not just building the infrastructure, even if it addresses all the issues, but also making sure that there's culture change built around it, because I think that's another issue that I've heard, that the adoption of the community information exchanges often isn't too great, and maybe that's something that can be addressed through regulation. Something like how ACA really sort of forces all the healthcare systems in the United States to adopt electronic health information, and have and be able to exchange information across the systems, or maybe it needs to be something more grassroots, and something. But that culture change, I think, is very important in making sure that something like that succeeds.
Absolutely, that's important. I don't know if we have time for one more question. I don't think we do, but maybe just very quick take. my sense is it may be possible to design an intervention that addresses, cross-sector alignment kind of on its own, isolated. If you do it really, really well, it may be possible to just design your intervention and figure a way for it to bring alignment into play. But it seems to me it's clear that there has to be collaboration, there has to be communication, there have to be multiple players, all of them involved. 30 seconds for each of you. How do you build buying into an intervention? When you have to reach out, if you're in the health sector and you have to reach out to social services, you have to reach out to justice, you have to reach out to housing, public health. How have you seen those who have been able to create strong buy-in? How have they been able to do it? I don't know if you can answer these entire questions, but you kind of have to. So start with Jesus or Hisan. Either of you want to take a shot at this?
Sure. I mean, I would just have to say that there just needs to be genuine concern and interest in wanting to work together in addressing issues that are facing their communities. So I think as long as you are able to make the case by how your organization plays or their organization plays a critical role in the response to a vulnerable population in the case of homeless services, I think that's a start for getting people to buy into the work of working together in a collaborative sort of way, which is, as we all know, incredibly hard and taxing, but also incredibly valuable as well. So I think just starting from a very genuine, transparent, and mutually beneficial way could be, the strategy for getting buy-in.
Thank you. Erin?
I think this echoes what Hesse said, and this goes back to one of the answers that I mentioned, which is shared purpose. Obviously, I think many providers see the shared purpose of helping the clients, but I think if we can really instill that sense of shared purpose, and partly through data, for instance, because for Mama's Neighborhood, one way that they can get the providers to buy in is to see how bad the birth outcomes are among this population, and just how severe the needs are across housing instability, substance use, and whatnot. I think that helps to instill that sense of shared purpose, and then also flexibility. I think. With the Mama's Neighborhood initiative, I think it finds that in the beginning it has this, relatively, it's well designed but kind of rigid criteria about how you can become part of the collaborative, and that wasn't very successful in achieving buy-in into the collaborative. I think the initiative decided that the relationships can be more informal, and relationships can be built to create something that is more formal as the time goes on, and I think that really helps to bring in more providers into the fold.
Thank you. Well, those were fantastic answers. Thank you to all your panelists. Thank you to all of you who stuck around till the end. We look forward to having you in our future panels and the Work in Progress series from Systems for Action. Have a great rest of the week, everyone.